Are you someone who takes Lisinopril or know someone who does? Well, I have some important information to share with you today about Lisinopril, which is often used as the first treatment choice for high blood pressure and heart conditions. So in this video, we will discuss the side effects of Lisinopril that you absolutely need to know about. But hey, do not panic just yet, because my mission is not to scare you, but I'm here to encourage and empower you with the knowledge so you can make informed decisions about your health. DrJedosaThePharmD here. Welcome, and please like and subscribe to the channel. Now, before we get started, you may be wondering, so what is the secret behind how Lisinopril works to lower your blood pressure? Well, Lisinopril belongs to a drug class called ACE inhibitors, which stands for angiotensin converting enzyme inhibitors, meaning it has the power to relax and make your blood vessels wider. Think of it as making a clear path for your blood to flow more easily, which reduces the workload of your heart. With that being said, the first common side effect is a dry cough. Now, you may already know about this unwanted side effect. When you have this side effect, it may feel scratchy or ticklish in your throat, and you may find yourself coughing over and over without being able to clear anything from your chest. So why does Lisinopril cause this dry cough? Well, let me explain. Lisinopril can cause your body to accumulate two compounds called bradykinin and substance P. When these chemicals accumulate in your body, they can cause your airways to narrow, leading to a dry cough. And here is an important point. The dry cough caused by Lisinopril usually tends to occur within the first few weeks of starting the medication. But guess what? It can also surprise you at any time, even after using the medication for a long time. And unfortunately, for many individuals, this side effect often stays and does not go away on its own. So what can you do if you find yourself dealing with this dry cough? Well, your doctor may recommend switching to a different type of medication called an angiotensin II receptor blocker, ARB, such as losartan or valsartan. These ARBs work like Lisinopril, but they are less likely to cause a dry cough. Number 2, dizziness. So what is the deal with Lisinopril and dizziness? Well, it turns out that dizziness is a common issue for many people who take Lisinopril. In fact, a clinical study found that up to 19% of people who take Lisinopril complain of feeling dizzy. And here is why. As already mentioned, when you take Lisinopril, it relaxes your blood vessels, leading to lower blood pressure, which is great for your heart. However, sometimes things can get a little unstable when your blood pressure drops too much or too quickly. That's when dizziness can sneak in and make you feel out of balance. Now, it is important to be mindful of this side effect, especially for older people who may have an increased risk of falling. But here is the good news. The risk of dizziness tends to be higher when you first start taking Lisinopril or if you are taking a higher dose. And as your body gets used to the medication, it often goes away. But do not let dizziness bring you down. Here is what you can do to help overcome dizziness. When you are sitting or laying down and it's time to get up, take it slow. Number 3, hypotension. This is a fancy word for low blood pressure. Now, here is an interesting point. While lisinopril can be highly effective at treating high blood pressure, sometimes it can lower your blood pressure a bit too much, causing hypotension. But why does this happen? One of the main reasons is that lisinopril has the power to decrease pressure in your blood vessels below the normal range, leading to hypotension. And when your blood pressure drops, it can bring along some noticeable symptoms like feeling dizzy, tired, and even faint. But to overcome this side effect, your doctor may start you on a lower dose and slowly increase the dose as your body adjusts. In addition, it is also important to monitor your blood pressure regularly while taking lisinopril. Number 4. Hyperkalemia. It may sound complicated, but it simply means you have too much potassium in your body. So how does lisinopril mess with your potassium levels? Well, here's the deal. Normally, our kidneys work hard to filter out excess potassium and keep it at the right level. However, when you take lisinopril, things can get a little tricky, and here's why. Lisinopril has the power to interfere with this natural process. You see, lisinopril can reduce the amount of aldosterone, a hormone that helps regulate potassium in our bodies. And when aldosterone levels drop, your kidneys may not be as efficient at getting rid of excess potassium. This can cause potassium to build up in your body, which is not good. But also keep in mind that the risk of developing hyperkalemia tends to increase if you have diabetes, kidney disease, or are taking medications that can raise potassium levels, such as aldactone. So keep an eye out for symptoms such as muscle weakness, nausea, chest pain, or irregular heartbeats. And make sure you communicate with your doctor if you notice any of these symptoms. Number 5. Swelling of the face, lips, mouth, or throat. Lisinopril can cause this rare side effect, which is also known as angioedema. This unique side effect involves swelling, typically in the face, lips, neck, or mouth, and it's not normal swelling. Now, you may be curious to know, how does this happen? Well, let me explain. When you take lisinopril, it can cause an accumulation of two proteins in your body, bradykinin and substance P, as we mentioned earlier. When these proteins build up, they can cause swelling. And in severe cases, this swelling can even block your airways, making it difficult to breathe. As you can imagine, this is not something to be taken lightly. In fact, it can be quite serious and potentially life-threatening. Now, this side effect can happen to anyone taking lisinopril, even if they have been taking it for a long time. However, the risk of experiencing this side effect tends to increase if you are a person of African descent, a woman older than 65, a smoker, or taking aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Now, with this knowledge in mind, it is very important to note that if you notice any unusual swelling or have difficulty breathing, reach out to your doctor or seek medical attention right away. That being said, here is the important point. Each person's body is unique, and not everyone will experience these side effects. And remember, the side effects we discussed in this video are not all the things that can happen when you take lisinopril. In addition to the ones already mentioned, it is worth noting that other potential side effects include headaches, increased creatinine levels, and liver damage. And there you have it. Remember, knowledge is power. and you have the power to make informed decisions for your health. Stay awesome, stay curious, and keep rocking the knowledge. Thanks for watching.